A lot of our patients have chronic leg swelling and they end up coming to us, and we look at two main pathologies. One of them is lymphedema and the other is venous insufficiency. In the case of lymphedema, you have multiple small networks of lymphatics that are like tiny webs all through your subcutaneous tissue that move water up and back into your thorax, essentially. For some reason, the lymphatics don't function and the patient has a lot of leg swelling and edema. In the case of venous insufficiency, what happens is there's valves in the veins and those valves break. And all of a sudden the person's leg swells because the blood is pooling in the lower extremity. Both of those pathologies contribute to leg swelling, and that's why we end up treating that.
Chronic venous insufficiency affects 8% of the US population, and this percentage will only rise due to obesity, cancer, and an aging population.
If our veins can't pump the fluid back up into the rest of our body or the extremities, it tends to settle and then swelling happens, and then the water or the fluid has nowhere to go, and therefore ulcerations are secondary to this.
One day at work, I was walking around and I felt like I got water in my boot. I finally went into my little mobile office I have, and I looked down and there was just blood flowing out of my boot. Finally was pushed by my wife to go to the doctor. They actually knew what they were talking about, and they told me it's actually a venous ulcer.
So some of the patients who have extreme venous insufficiency and swelling and open ulcerations that are non-healing, which actually debilitates their day-to-day life.
You know, he's been crawling already for a month. If it wouldn't have been for the BioTab, I wouldn't be able to go down and crawl with him.
Following treatment, we see a massive reduction in edema, improved pain levels, rapid improvement in venous ulcer healing, and prevention of wound reoccurrence.
Many patients out there suffer from chronic lower extremity swelling, and they don't really know about all the available options. I think a lot of them, when they finally get to a pneumatic compression device and a company like BioTab, they're just shocked that they did not pursue that at an earlier time. The pneumatic compression devices can literally be life-changing for some of these people.
I feel like I have become more active in life because I used to just sort of come home, lay down, be in pain, put a heating pad or ice pack on, and now I will sometimes come home, put the compression, and then I go out and walk and do more exercise, so I feel more energetic.
And one of the huge things about the pump is that you can say to the person, you can do it in the comfort of your own home. Compliance then is much higher in the patient populations, so you're going to gain more benefit, I think, over time.
Fine, so I had access to some different pumps that I tried out, and the ones that I found were lots of Velcro and very cumbersome. I just didn't get the same result that I did with the BioTab. It's so easy to use.
Not only do I prescribe the compression pumps to patients, and I'm the person recommending them, but I'm an advocate for it myself. I use them myself after a long day of surgery. If it makes me feel this good after a long day in my field and my work that I do, I know that it's beneficial for these patients.
With our extremely high rates of compliancy for in-home therapy, we're confident at BioTab that we will continue to offer the industry's most compassionate care and expertise with every patient we service suffering from lymphatic, wound, and circulatory disorders.
There's a lot of satisfaction in helping somebody who's had a chronic problem suddenly find a way to fix it and have a huge effect in their lives. It's very gratifying professionally.